Now I will discuss the concerns associated with refractive amblyopia. If refractive amblyopia is left untreated, it can lead to several complications. First, it may result in permanent vision loss in one eye, especially if the condition is not treated during the critical period of visual development. Second, it can cause reduced binocular vision, meaning the eyes cannot work properly together. Third, patients may experience poor depth perception or stereopsis, which can affect activities that require accurate spatial judgment. Fourth, children with amblyopia may have difficulty with academic and daily activities, especially tasks that require sustained visual attention, such as reading or writing. Another important is that if the healthy eye becomes injured or diseased later in life, the individual may develop significant visual disability because the amblyopic eye does not provide adequate vision. Additionally, studies shows that amblyopia can occur in about 25% of treated children, which is why continuous monitoring and follow-up care are highly recommended. Tas, ngayon naman, i-discuss ko yung rehabilitation focus and goals for refractive amblyopia. Vision rehabilitation focuses on improving visual acuity, binocular vision, and overall visual function. The first focus of rehabilitation is strengthening the amblyopic eye so that it can function more effectively. The second focus is improving binocular coordination, allowing both eyes to work together properly. Another important focus is enhancing visual processing and fixation stability, which helps improve the brain's ability to interpret visual information. Rehabilitation also aims to prevent recurrence of amblyopia, which can happen even after successful treatment. The goals of rehabilitation include the following. First is to achieve the best possible visual acuity in the amblyopic eye. Second, to restore binocular vision and stereopsis whenever possible, allowing the patient to regain depth perception. Third, to encourage equal use of both eyes during daily activities, which promotes balanced visual development. Fourth, to improve visual efficiency for reading, learning, and everyday tasks. Finally, long-term follow-up care is important in order to maintain visual stability and to monitor the patient's progress over time.
So, for the recommendations in managing refractive amblyopia, early detection is very important kasi regular vision screening in children should be conducted because yung amblyopia often develops siya during the early childhood when the visual system is still developing. So, early identification of refractive errors nag-aalaw siya timely treatment at magpe-prevent siya ng permanent visual impairment. So, another important recommendation is a proper optical corrections. By providing the accurate prescription glasses, it helps to deliver a clear images to the retina, which is it supports the normal visual development and reduce the suppression of the amblyopic eye. And compliance with a treatment is also essential. Yung patient and caregivers must consistently follow the prescribed management such as patching, atropine penalization, or vision therapy. Kasi yung treatment, its success na greatly depends on the adherence. So, vision therapy is also recommended siya para mag-improve yung binocular coordination, fixation stability, and visual processing. So, through these structured visual exercises, yung brain natin natitrain siya para gamitin yung amblyopic eye more effectively. So, regular follow-up and monitoring are also necessary. So, continuous eye examination, nakakatulong siya para matrack yung visual improvement, ma-adjust yung treatment kung kailangan and ma-prevent yung recurrence of amblyopia. And lastly, educating patients and parents about the condition is very important. Kasi when the families ay naiintindihan nila yung gaano ka-importante yung treatment and follow-up care, nag-i-increase to ng compliance and improve the overall visual outcome of the patient. Next slide.
For the conclusion, refractive amblyopia is a neurodevelopmental vision disorder caused mainly by uncorrected refractive errors, leading to reduced visual acuity and poor binocular function even though the eyes appear structurally normal. It commonly occurs with conditions like anisometropia, isoametropia, and meridional refractive errors, which prevent the brain from receiving clear images from both eyes. Because it often shows no obvious symptoms, early detection through comprehensive eye examinations is essential. Treatment is most effective during childhood and may include glasses, occlusion, atropine therapy, and vision therapy to improve vision and restore proper coordination between the eyes. If untreated, refractive amblyopia can cause permanent vision loss and functional difficulties in daily life. Therefore, early diagnosis, timely treatment, and continuous follow-up are crucial to restore functional vision, promote balanced use of both eyes, and improve overall quality of life. Meaning, ang refractive amblyopia ay isang kondisyon ng mata na hindi naitama yung refractive error. Kung kaya nagiging mahina po ang linaw ng paningin at hindi balance ang pagtutulungan ng dalawang mata kahit normal po yung structure nito, na madalas itong kaugnay ng mga kondisyon tulad ng anisometropia, isoametropia, at meridional refractive errors. Kung hindi po ito matitreat or maaagapan ng mas maaga at mas napapabayaan, maaaring magdulot ang refractive amblyopia ng permanenteng pagkawala ng malinaw na paningin. Next slide.
So, for the key takeaways and definition of terms, isa-summarize ko na lang po siya. So, refractive amblyopia is a neurodevelopmental visual disorder na nagkakos po ng uncorrected refractive errors that interfere with the normal developmental of vision. So, dahil sa brain na to, nakaka-receive siya ng blur images from one or both eyes. So, nasosuppress niya yung input from the weaker eye. So, nagli-lead siya to reduce visual acuity and poor binocular function. So, one important thing na to remember is that refractive amblyopia is has no obvious physical signs, which is why early vision screening and comprehensive eye examinations are very important for early detection. So, yung mga condition na to is commonly associated siya with anisometropia, isoametropia, and meridional amblyopia na nagkakos ng high astigmatism. So, by early detected, treatments such as corrective lenses, occlusion therapy, and atropine penalization and vision therapy can significantly improve visual outcomes. And lastly, continuous monitoring and vision rehabilitation are essential to strengthen the amblyopic eye, restore binocular vision, and prevent recurrence. So ultimately, helping improve the patient's visual function and quality of life. Next po. So, yun lang po. Thank you po. Okay.